Good afternoon, ladies and gentlemen. This is Bob Sweeney. I'm a principal and co-founder of Global Health Impact Fund, a national venture capital firm focused on digital health and telemedicine. My guest tonight is Michael Pocalyko, a true polymath I've known for more than 20 years. He's been a tech CEO, he's been an investment banker, he's the author of a definitive book about the Washington Inside called The Navigator, published in 2013. He is an advisor now to the Global Health Impact Fund, I'm pleased to say. And he's truly an individual who's done as many things as you could imagine in a creative life. We've been planning this meeting for quite a while, since the election, in fact, but everything changed last Wednesday night. We tend to think of this now as a moment of national reflection or national inflection. And I would like to ask Mike for his comments on that. He was the author of an article in an academic journal in 2017 on what he forecast would be the nature of the Trump administration. Mike thought that it would be disruptive, and it would be disruptive for the economy and the society. Where do you stand today on that, Mike?
Well, things are a little bit different today. If I were revisiting that piece, and Bob, thank you, and thank you to the Impact Fund for having me. This is normally the point in a conversation where you get witty and funny and self-deprecating, but that is not the national mood, nor is that appropriate. In analyzing what's occurred in the Trump administration and in the presidential transition, the first thing you have to ask is whether it is even possible to have an objective analysis of the Trump administration. It was a disruptive presidency, as I had said. Trump, I then wrote, was unconcerned about confronting opposing agendas, including those agendas within the Republican Party. If I'm reflecting on the last 4 years, I want to suggest that this is Shakespearean in scope. It's actually the literary metaphor that's best is probably you should all look up Dylan Thomas's poem, the Second Coming, where what rough beast comes round its hour at last, slouching towards Bethlehem to be born. It's also where he said the best lack all conviction and the worst are filled with passionate intensity. And this is really a moment of passionate intensity. A lot happened and everything changed last Wednesday, Bob.
Have you ever met Trump, by the way, Mike?
I have. I met him before he declared his candidacy for presidency. It was at a University of Pennsylvania event. And at the time I found he was most famous then for being the host of The Apprentice. I found him to be gregarious, self-effacing, but he was performing. And I think what you've seen in the last couple of weeks, and certainly in the time since the election, is Trump unvarnished and in an emotional reflection of what he truly believes. And this is going to be one tough presidential transition as a result.
Well, last week, as we all know, there was an event that is commonly called an insurrection. It was certainly a disruption of how we normally do things. I'm wondering how you imagine that affects the topic tonight, the impact of transition on the economy and on healthcare particularly.
You know what, and I agree, Bob. We have never seen anything like what happened last Wednesday. I spent the weekend with my daughter, whom you know, remember Katie as a teenager. When she was 16, she was a United States Capitol page for the United States Senate. And it was a deeply emotional moment for her. She's now a Lutheran pastor in Richmond. But I want to tell you, as blunt as I can be, this was as important as 9/11, and it was more consequential for America in the world than 9/11. What we are seeing is a Clausewitzian moment. This is Clausewitz wrote about war, but he spoke about a continuum of politics by other means, and this
Right.
was a distillation of politics by a very violent means. Persons expressing what they believe to be longstanding perceived grievances and reacting at trends that they are unable to affect uh, with an amplification effect from the internet. And the long-term effects, particularly for the United States in our relations with newly democratizing nations, this is long-term and this is enduring. The effect of the United States in the world by this is just horrific. I've worked democratization efforts in places like Russia and Ukraine and Kosovo. Um, and for anyone who's an adult, this is the moment where the United States in the rest of our lives have begun.
Do you have one of the things we've talked about amongst ourselves is how in this kind of situation, the urgent often replaces that which is necessary in terms of decision making.
Yeah,
Do you
well,
see any of that going on here?
I do. Look, it's displaced COVID-19. I've pulled some statistics we'll talk about when we speak about the pandemic, but the most important thing facing the nation and the world right now is the multidimensionality of the COVID-19 pandemic, and the urgency of this has just displaced those dimensions. Look, I looked up at the Johns Hopkins says that as of this afternoon, there are 22,797,700 total cases of COVID in the United States. On the 11th yesterday alone, we had 223,000 new cases and 2,048 deaths. Now, if you're also figuring, as most public health experts do, that there is a somewhere between 5% to 10% underreporting, just think about that. We have 129,000 new hospitalizations. We're averaging 7,250 a day in new hospitalizations, and our 14-day marginal increase is 37% over the last 2 weeks. Um, Bob, you had asked me to prepare what are the dimensions of this COVID-19 pandemic.
Right.
Um, this is about national security. It's about our ability to effect an enduring economic recovery. Public health is only third or fourth in the importance of the COVID pandemic. Healthcare policy is going to be affected throughout the Biden administration. We haven't even begun to address the cyber dimensions. This is how we meet now. I mean, if this were occurring in 2018 or 19, I'd be speaking to you and our friends in the Impact Fund in a closed hotel room in Los Angeles. We can't do that now. The good news is we're able to speak to friends around the world. But the bad news is that this is now an enduring means and way of doing business. It affects privacy and civil rights. It affects diversity and inclusion in terms of the way the pandemic is disproportionately affecting underserved and traditionally displaced populations, and not to mention global policy and the relief that's going to be required. This thing is just beginning in certain parts of the world.
Mike, you've got an audience here that has a considerable number of clinical or medical people listening. I realize you're not an epidemiologist, but in terms of
I did chair a biotech firm, though.
yeah, but in terms of the actual policy making or decision direction of the new administration, contrast that if you can with what's been going on under the current administration. Again, I'm not trying to be political about it. I'm trying to look at what's going to actually change.
And actually, Bob, that's a good point, because like these discussions and you and I have been having for almost 25 years, we're not about political only in the sense that there is a national polity that is required within this. I think what you're going to see is a more practical, pragmatic approach to the pandemic. You will see a greater emphasis on the role of the federal government. You will see an opening of federal resources. I will expect that there will be a greater degree of, for want of a better word, truth telling from the central administration view. In the best sense of the word, the president and the executive office of the president will likely be more engaged directly in the COVID responses. And I think you'll probably see a more publicly nuanced and more professional handles on government. In other words, governance of public health matters. Honestly, I don't think that's a Democratic or Republican response. I think it's a difference in style and a difference in the persons south of the president within the executive office of the president who are incoming, and those would be my expectations in the pandemic.
Do you imagine that these efforts and the costs associated with these efforts to deal with the pandemic are going to interfere in any way with economic recovery or broader, but more broadly put, what do you see in terms of economic recovery that's going to be a different strategy or an improved strategy in the new administration?
I think you are going to see a difference in approach to the economic recovery. I thought you were going to ask me when the recovery will actually begin and what that means.
Sounds like a good question. Tell us when that's going to happen, Mike.
Okay. Like every other person trained in economics, I'll make a prediction. I don't think you're going to see a significant uptick in the economy that would indicate the end of the recession. It's interesting. Everybody agrees on how you can tell a recession begins, but economists differ. Remember, this is a global recession, and it is an American recession. And the onset really began on the 20th of February in 2020. I'm going to suggest that you'll see an uptick beginning in third and fourth quarter of the current fiscal year 21. Remember, we lost 22 million jobs net in the COVID onset recession. There was a brief market crash. Two major sectors of the economy, specifically tourism and hospitality, which are, aggregate roughly a quarter of the economy, will never recover to the extent that they had in 2018 and 19. Service industries general, including the company that I run, saw revenue declines. You saw oil prices decreasing, although that's been a trend long before the recession. The biggest trend I'm going to suggest to you, and this is important for the entrepreneurs and the medical doctors and the investors that we have joining us this afternoon.
Professionals as well, Mike.
Yeah. Small versus large businesses. There are some sectors of this economy that are doing very well and have been, but we're also increasing our government debt. For the first time since World War II, government debt as a percentage of GDP is more than 100%. And when we were entering 2019, a pretty good year for both markets and the economy, we were at 79% of GDP. Our deficit right now is 3.3 trillion in a GDP of about 21 trillion. So you're talking about 15% of GDP. And consumer activity is flat. During the George W. Bush administration, the Obama administration, and the first 2/3 of the Trump administration, we had 121 months of a very good run. And you can lay that on the groundwork done in the presidential transition of 2008. But in order to see some growth in real GDP, you're going to need a stable upturn in consumer spending and in private equity investment, which we'll talk about later. But that also means that we have some extraordinary opportunities in exactly the kind of places that the Global Health Impact Fund is placing in those sectors.
What do you think? I mean, while we're on this topic, what's going to happen with the ACA? I mean, there's a lot of informal chat about it. There's a lot of knowledge, quote unquote, that is being spouted by different sources. What's really going to happen there, either to shore it up or expand it or modify it? What's going on?
Well, I want to take the president-elect and vice president-elect at their word. They both were very clear that they were about revitalizing, if not the Affordable Care Act in some specific incarnation, then those portions of the ACA. What's likely to happen is that the public health and health care agendas are going to merge. You're going to see probably within other legislation. Remember, we're in a divided government and an evenly divided government. So you're not going to see major legislative changes. I think there's great bipartisan agreement on healthcare portability, on pre-existing conditions. You're going to see a migration. I want to suggest to all of our medical doctor friends a migration to larger hospital systems and larger medical practices. The era of the small practice, like the era of the small company, is going to be under siege. You'll see a greater emphasis in economic incentives on enfranchising preventive health care versus critical care. And I want to suggest to you, and this is a subject for another 45-minute talk, both the civil rights imperatives of healthcare and the climate change imperatives of healthcare, both of which require a little bit of nuance again. Market forces will revive, and you'll see some portions of the ACA with what was good about the exchanges and the market competition in the insurance industries will be taken over by some private markets. And I will predict that there will not be Medicare for all. One of the things that I believe that elements of the progressive left doesn't understand is that Medicare truly is, you have to pay for that. If you're a high net worth individual, you have a significant contribution to Medicare. It is an element that takes a lot of economics and a lot of accounting planning. So no Medicare for all within certainly the first 2 years of the Biden administration.
While we're talking about the future, let's also take a quick look at the past. You know, I was trained as a historian. You were trained in political science, economics, and other areas. We have a experience in reading traditional historians and economists, Arthur Schlesinger. You mentioned earlier the German military strategist von Clausewitz. You know, what do you think, 25, 50 years from now will be the legacy of the Trump administration? 2, 3, 4 things you think will be remembered, and what's in the Biden administration's inbox that he has to focus on early? Maybe they aren't the same question, but one leads to the other.
It does. They're two sides of the same coin. And again, we're here to talk about the implications of the presidential transition. In the Trump legacy, you have to start with January 6, 2021. That is just unreal with respect to its long-term implications, which we are still in that moment. I mean, I know that my friends in Richmond are trying to figure out what indeed is going to happen this Saturday when the chatter is all about demonstrations, and in some cases armed demonstrations in 50 state capitals. The primary legacy that I believe 50 years from now will be mentioned about the Trump administration may surprise you. Um, of the 23 Republican candidates in the primaries beginning in 2015 and 16, I challenge you to name any candidate that would have had a different record in Republican and conservative and federalist and originalist appointees to the federal bench at all levels, other than the exact court appointees that President Trump placed and that largely a Republican Senate confirmed. Trump will have a legacy of dissonance. My old mentor, Richard Neustadt, who's now deceased about 15 years, spoke about the fundamental legacy of all presidents as a legacy of weakness. And I think you're going to find Trump will be perceived as a very weak president because he was uncomfortable with sharing power and operating the segmented and separated institutional power of the federal government, and in particular, the separated powers of the executive branch. It oversees the dismantling of longstanding and respected and strong coalitions in NATO, in Asia, bilateral relationships have suffered. You will see some effects positive within the Middle East. And the last major legacy is the legacy of, for better term, Trumpism within the Republican Party. And whether that's a positive or negative, I'll say where you stand depends on where you sit. Now, concerning the Biden inbox, boy, that's a big inbox. It's stacked as deep as the one I have over here. Number one on the Biden inbox is COVID. And it should be number 1, 2, and 3 for the president. But I would certainly say next would be national security, certainly the Joint Comprehensive Plan of Action and Iran, China, Russia. Um, uh, you absolutely are going to have to address what happened with Russia's intrusion on our cyber sovereignty. And I will state unequivocally, yes, that was Russia. And we've largely completely forgotten about that in the press of what's happening in COVID and in terms of what's in coding. That's the solar winds incursion. Um, uh, the president-elect has said he will be a healer. Um, that's going to be difficult both in divided government and in the extent of opposition within certain elements of the Republican parties. I want to point out, though, that in the Biden inbox, um, I tried to find, Bob, you're the historian, but what election was most like the election of 2020? And I'm going to suggest, and I went back to 1854 to look for that.
Okay, good.
It was actually the election of 1960, which both of us can remember. Um, and for those millennials joining us, that was the election in which Senator John F. Kennedy of Massachusetts defeated the sitting Vice President of the United States, Richard M. Nixon of California. Biden,
Remember it well.
yeah, exactly. Biden won his electoral victory with a 306 to 232. Kennedy won his electoral victory 303 to 219, but 15 electors cast their votes for Richard Byrd. And those were the Dixiecrats and the segregationists.
Right.
By the way, those were, for those of you interested, there were 14 unpledged electors from Mississippi that voted for Byrd, and one faithless elector from Oklahoma voted for Byrd, which puts Biden and Kennedy exactly the same. But the difference is there was no blue wave for Joe Biden. So those on the Democratic side that are predicting that that were predicting, that this would be a massive coattails, every Democratic president since the creation of the Republican Party, going back to 1854, brought in a Democratic House and Senate. And the only thing that denied, that almost denied that to President-elect Biden was Georgia. And in what is still a very red state, I want to suggest that it was the influence of President Trump and some excellent organizing that kept the Senate at 50-50. The House right now, by the way, for President-elect Biden is 222 Democrats, 211 Republicans, one vacancy. That's a Republican vacancy. That was Luke Letlow in Louisiana, who died of COVID in the 5th District of Louisiana. JFK, by contrast, had 64 senators and 262 in the House with 153 Republicans. So um, Biden's inbox is going to be a little tougher, and he's going to have a more difficult time than the last time we had an election. By the way, last point on 60 versus 2020. Kennedy's margin was 17/100ths of 1% of the popular vote. Biden's popular vote margin for roughly the same electoral margin was 4.4% of the popular vote.
Very interesting. Do you think, or can you think concretely about what the business community and the investment community can do, or should do, or in any kind of a broad sense, to bring the country together, to move the economy forward, to help us coalesce on policies that are good for the nation?
Yeah, I think we do have a responsibility, and Bob, now you and I are going to show kind of our business political stripes to our audience. I've long believed that the business community, and this is partly from my background in government, in political office as an appointee, as a failed candidate for public office once back a million years ago. Um, we we have to shoulder a responsibility, or else persons who have no idea how to run businesses will be taking the mantle and operating the levers of government in ways that are antithetical to the best interests of our companies, our shareholders, the people whom we take care of in our businesses, the communities that we serve with our businesses, and those of us who believe deeply in a fundamental social responsibility of business as business will be left behind. Um, we need to take that up, or others will take it up for us. We have we're now facing some very difficult times with divided government in a divided nation. Um, there's no way to get around that.
Yeah. One of my views about that, Mike, and maybe you agree with me, is that we've done a poor job as a society in educating our leadership to the meaning of fiduciary duty, conflict of interest, self-dealing, things like that. Uh, Business, actually, people that work in business are far more skilled in facing these issues than those in politics. And I would like to believe, go ahead.
I want to say, Bob, as a general statement, that's correct, but we have some really knuckleheaded and really bad ethics in business at certain levels.
Sure.
I think it's a bimodal distribution for those of you that are good statisticians here, at the lowest end and at the highest end. I've said elsewhere that I believe we are entering the golden age of fraud in business. And more of it is being enabled by exactly this. It's the reason why my firm SI is chasing fraud and money laundering worldwide. But I do believe that the best of us in the business community, just like the best in the civil service, the best in the military, the best in my beloved intelligence community, the best in government contracting, really truly understand our fundamental responsibilities to society.
I
Um,
think it applies to medicine as well. I might as
oh,
well
of
mention.
course.
Yeah,
The difference is that those that go into medicine begin with a fundamental social charge. You don't enter medicine. You don't study that hard. You don't put up with the extraordinary apprenticeship that every medical doctor or every doctor of osteopathy has to go through in order to become in the profession, beginning with the first test in freshman chemistry, without having a fundamental social purpose. Um, but we have a lot of folks, especially in the market and financial community, that develop that social conscience late.
yeah,
But that's a subject for another time.
it
Uh,
is. Right. Well, while we're talking about the markets, though, what do you think we can expect from the capital markets and investment world as we get into the next administration?
well, a couple things. First of all, I want to get back to what we spoke about divided government. Um,
Okay.
the markets like stability. And in times of divided government, like now, when we have a 50-50 United States Senate, what you find first of all is that the centrists get enabled. Let me make a prediction that keep your eye on about 6 or 7 senators, and I'll name them. Um, the markets like constancy. Keep your eye on guys on the Democratic side, guys and women like Joe Manchin in West Virginia, John Tester in Montana, Kirsten Sinema in Arizona, and new Senator Mark Kelly from Arizona, whom I know, all of whom either ran or have governed as centrist Democrats. And that's a very I think there are more growing centrist Democrats than centrist Republicans right now. But on the Republican side, these are familiar names. Senator Murkowski in Alaska, Susan Collins in Maine, and of course, Mitt Romney in Utah. Um, but the markets for the near term are going to be pandemic driven. And now this is counterintuitive, but the markets are becoming less and less of an indicator of the general economy.
Right.
There are fewer middle class and upper middle class persons who actually trade stocks. 2020, despite the pandemic, was not a bad year. And here's where I have to say, yeah, I'm trained in economics, but I am not a market analyst. But I did look at some key indicators. The S&P 500 in 2020, remember, we're only now, today's the 12th, we're 12 days into 2021. So we're starting to begin to see some trends. 2020, the markets were up, U.S. equities, Standard & Poor 500, up 16.26%. Dow Jones Industrial Average, up 7.25%. S&P Mid Cap 400 up 11.81%. Small Cap 600 Standard & Poor's 9.57%. Now that's a good year. Now, but 2019, if you look at the correspondent S&P 500 U.S. equities 500, 31.49%. You asked me about private equity. You asked me to prepare this. McKinsey is the most recent numbers I can find on private equity. They lag the public markets because they're not reported as rapidly.
Right.
But using 2019 data, global private markets were about 778 billion. Now remember, when you're talking private markets, you're also talking things like private debt and real estate. When you segregate just private equity, the stuff that this fund and its investors are doing, you're looking at a global 2019 number of around 385 billion. Now, the portion of that that's from the United States and Canada is about 448 billion in private markets and 212 billion in private equity. Now, how much of that? How much has that grown? So I asked some of our analysts here to look at that, and we're looking at about a 7.8% increase year over year. Our estimates are that 2020 was around 251 billion in private equity, of which somewhere between 27 and 32% is required to be deployed in 2021, which means that we're looking at somewhere between 75 and 80 billion dollars in private equity deployment in 2021. That's very good news for this kind of fund and for the accelerant effects that an impact fund can have on private investment in a small corporation.
Okay. Other than, and I'm presuming, I mean, a fund like ours focuses in a targeted area. It just happens to be a targeted area of healthcare. Have you got any perspective on what kinds of ventures will have the greatest impact or are the most appealing in healthcare or healthcare technology writ large, and what we might want to try to avoid?
I can answer the first part of that easier than the second part. Remember what an impact fund is. It is that place that you can have the largest sector impact, where the application of capital, and that includes debt and equity capital, can have the most propitious response and can actually do some social good. So the question you fundamentally ask is, where can you have a sector impact? And within global health, I want to suggest about what do I have here? I have 6 that are written down, and this is, and I'll hold to this with the caveat that I am only one executive advisor to the Global Health Impact Fund, and that other advisors may have additional views. I think number 1 is medical and bioinformatics. Number 2 would be any virology that is coming, and that narrow tranche of the biotechnology and biopharmaceutical industry that affects antiviral and clinical virology. The third is a little bit broader, applied biotechnology, fungible pharmacology. In other words, certain new drug technologies that are beyond the proof of concept stage that can be applied to multiple levels, multiple disease vectors, multiple systems, and in particular, cancer therapeutic technologies and those technologies that affect biologics in the autoimmune space. Fourth, I would say all medical systems and services that would service the information technology and the managed security systems of large hospitals. Look, and again, this is what our firm SI Cyber does. The insecurity of medical systems has been shown to be a big red flag during the COVID pandemic. Let me use a metaphor for you about this. And for those of our participants who are in large hospital systems, I hope you're nodding your heads now. I speak the German language, and I tested in the State Department at a level 3+. So if you didn't speak German and heard me speaking German to a native German speaker, you'd think I'm really fluent. But that German speaker is saying, okay, this guy may be educated, but he doesn't speak German like I do. And every time you hear a cybersecurity or cyber assurance expert in a hospital, keep in mind, he knows more than you do, and he's very good at showing you that. But is he truly a cyber assurance expert? It's the marginal knowledge base that has a lot of people selling false senses of cybersecurity. The fifth I'd like to suggest to you as an area for impact is health services on mobile devices and apps. We're only at the beginning of this. This is a 20-year journey, and the last relates to number 4, which is general cyber assurance of those apps and of medical information dispersed. And if you sense one theme there, Bob, it's medical and bioinformatics.
Right. Well, we've covered a lot of territory here, Mike. One thing that I didn't touch on that I want to try to get to before we leave is, this whole thing on last week and what's been going on for the last couple of years has had a kind of profound impact on the rest of the world, whether it's alliances or economics. I could even cite things in healthcare that are affected by this by these events. But where do we go from here? What do we do to build or rebuild our credibility? What do we do to I say do due diligence on the things that the Trump administration has put in place as to whether they're actually policies we want to continue? What's your view there?
My sense is that this is going to have a bigger impact internationally than we ever realized. I believe that you're going to see, and this is a pessimistic projection. You're going to see some extent of democratic backsliding throughout the world. As I mentioned, I did work in some democratization efforts, including at the very end of the Soviet Union almost 30 years ago in Russia and Ukraine. There are democratic movements throughout the world that are going to take pause at what happened in America. This is a major shock to the international body politic. We're not even focusing on that because we're still in the moment right here. But even large shocks don't always trigger necessary change. We need certainly a year or more of soul searching about how this occurred. Anybody who was surprised at it hasn't been paying attention. You're going to see an increase in great power rivalry. The rise of China is not going to stop. It will not abate. We have global challenges that are just extraordinary in North Korea, in Iran, Lebanon, Syria. We keep remembering the conflict that is there. Venezuela, certainly. Ukraine. The cyber threat from Russia is going to increase. It will affect our businesses. Brexit will have economic implications for the global recovery. How we recover from COVID in international public health is going to matter. Number one on the international agenda is going to be climate change. And all of those are going to be affected by what we saw on January 6th. I think that Vice President Biden, President-elect Biden, is going to recommit the national leadership to two branches of inequality. The income inequality question, which even affects how we invest, and the civil rights imperatives. Remember, we're only 50 years into full suffrage of the three major civil rights initiatives of the 1960s, which, Bob, you and I are old enough to remember as, in my case, a school kid, in your case, a high school and college kid, from the couple years you have on me. Never forget that we are seeing a receding of a major political party in the Republican Party that is trying to figure out its strategy going forward. You saw that in the positioning of the attempt at co-optation of the Trump religiosity. There's no other way to put it. But the Republican Party has only won the popular vote once in 8 elections from 1992 to 2020. And that was 2004, and that was the re-election of President George W. Bush. With each receding popular vote plebiscite that it's lost, the Republican Party has drifted further and further to a life of illiberalism, and I mean that in the sense of classic Western democracies. But look, if we know one thing about America, it is that we are adaptable, we are resilient, we are self-correcting because we place power in law, in the rule of law, in constitutional primacy, and we vest that power within institutions, not in individuals. Any individual, whether it's fiduciary duty in a corporation or in presidential power or in congressional leadership, one only has power. You only have the juice when you have the office. And therefore, it is the office, it is the institution that is enduring. And that, if anything else, Bob, is an incredibly optimistic message that I will choose to believe. That's my story, and I'm sticking to it.
I agree with that. I've lived through plenty of turmoil in my life, from the Eisenhower Adlai Stevenson debates and the Korean War until today. So I think,
Bob, don't you think this feels a lot like 1968?
it does. It does. It's a ironically from a different angle of the political spectrum, but it feels that way. It does.
Yeah, but I can assure you that President Biden isn't going to behave like President Nixon.
No.
Yeah.
Well, we've spent about 45 minutes or so talking here. I want to allow time for questions from the audience. But why don't you take a minute or so, Mike, since you're on a national platform, and I think
an international platform, Bob, with people joining us from around the world.
Okay, I'm glad to hear it. But anyhow, Mike, I've been on a lot of adventures with you. I remember going to the West Wing twice with you, once on a bioterrorism project, and once to help introduce the representatives for the Montagnard people from Southeast Asia to the
Absolutely.
State Department and the government there. So I know what you can do in action. I'd like you to tell the audience for just a minute or two what you're doing now and why, and then we'll move on to the Q&A. And people who want to send me Q&A can type questions in and chat them over.
We appreciate that. And by the way, we also ought to say thanks to BAMI and to our friends at Hands In, who have been, which is one of the health ventures of the fund, who have managed the technology and the back room for this. So, gentlemen, and the male pronoun is appropriate here. Thank you for the courtesy of providing this to the fund. I'm currently the Chief Executive Officer of SI, Special Investigations Limited Company, which has two business units, Special Investigations and SI Cyber. We are active in the government contracting and in the legal services and professional services spaces. We do fraud, money laundering, the kinds of investigations that will be necessary within the coming hot wash up after January 6th. We're particularly following special circumstances. I'm essentially a corporate fixer in a lot of ways, and that follows 21 years as chairman of Monticello Capital, which is now a private holding company, but was for almost 2 decades one of the leading mid-Atlantic investment banks and private equity operations. So I'm not new at the business that we are conducting in this fund. And Bob, thank you for permitting me that 30 seconds to talk about my company.
All right. Now I'll move over and take a look here and see if there's questions and comments that I might want to pass along.
Okay.
I've got some questions related to what we do as a business. I don't want to make this too much of a promotional activity, but I'll just take a second to mention that Global Health Impact is a venture fund focused on digital health and telemedicine. And the difference, one of the distinctive advantages of this fund, and actually the reason that I and my co-founding partner, Gary Goldman, went into this space was to make it possible for physicians to become relevant again in the selection of which technologies to invest in. So you can ask around, you don't have to be a doctor to do it, but go to any hospital or medical group and ask them the last time that somebody that was a big investment company investing in technology called them up and asked them what they thought about the new Zornithax that was going to be put in the emergency room. They never get asked that. So what happens is technology gets created. It may be very effective. It may be very cool, But if nobody uses it, that doesn't make any difference. And nobody may use it for reasons that only a physician or a nurse would understand. And if it doesn't really work anyhow at the end of the day, then there's a lot of wasted investment there. So a fund like ours, we're probably not the only one, but I know we are, starts with the clinical due diligence. We review the effectiveness and potential usefulness of a technology. And if we can't get docs in those specialties to agree that those things are going to be used and that they're going to be effective, we don't go any further. It's a little different way. We also we use just-in-time investing. So our group doesn't pile up a big pot of money and then go looking for places to put it. We have constant requests for investment in good companies. So we have plenty of opportunities and if we see something we think will work, then we raise the money for that investment, whether it's $1 million or 5 million or whatever number. That's the way we do it. And it works because there's a great thirst across the world on the part of clinicians to be taken seriously again and to have their say in what companies invest in and how they use it. I'll leave it at that. I don't want to bury the audience with promotional stuff. I feel very proud with what I do. I'm not doing it. I mean, I certainly care about making money, but that's not my primary motivation. I've got enough, and so I'm doing this because it's something I want to do.
Well, Bob, you're also, I have to say this about you and Gary. At an age and at a net worth where a lot of guys are happy to play golf, you're making an impact on the world, and we are still varsity, and we are still attempting to grow, to build, and to enhance the national economy. So for all of the advisors of the fund, thank you for what you're doing, and I'm confident that the investors are in their capital is in good hands.
Mike, I got a question for you here. This writer says cybersecurity issues in healthcare are huge. Thanks for raising this, Mike. Can you put a relative cost on this in terms of dollars?
I probably could, but I will be wrong. Look, the potentiality for losses here in terms of, it's in the trillions. It truly is. You're talking about maybe a third of the national economy when you're speaking about what is at risk in cyber assurance, in medical bioinformatics, because it touches absolutely every element of information technology. And the amount of wrong information that is being put out by persons being compensated very well within this field is huge. Let me tell you what forgive me, let me rephrase that. Permit me to share with you what I believe is the biggest risk within cyber assurance, and it is who is managing and manipulating your data. When you contract with a managed systems security provider, an MSSP, do you know who the guy is that's actually going to be managing your data? Who is the person, the individual human being in his or her personal capacity who is at the keyboard, who has access to your data? That's the scary thought right now. And you're going to see large data breaches within medical systems, within healthcare systems. We've already seen it in the Department of Veterans Affairs. I suspect that we have had them within the university medical environments, but that they've been carefully managed without public disclosure. This is a very, very delicate time. And we also know from what is publicly available from the intelligence community that this is a primary target of both the Chinese and the North Korean intrusive network attackers. So to put a number on it, would be difficult. But it is huge in the United States economy in terms of what is at risk. And I'd encourage anyone to contact me offline. I'm very easy to find.
Another question in this area. What would you think, or could you guesstimate for a typical community hospital? What would be the annual cost to fix their issues with these kinds of risks in order of magnitude?
Well, it would depend on the size. This is kind of like asking a medical doctor to diagnose by only seeing one symptom and not even knowing what the vitals of the patient are. How's that for a quick simile? You are talking. I would suggest to you that this should be somewhere on the order of 12-15% of the annual budget of a hospital system. And right now, the hospital system CEOs who are listening, their eyes are wide. They would love that increase. But remember, that is giving up some independence and some control. And all of you know that factor within hospital administrators.
You got some positive feedback on your comments, Mike. I'll leave it at that. Anybody else have anything you want to send over to me? Both Mike and I are available. We have contact information there. If something comes to mind you want to ask us about, we've probably got an opinion about it, and you can decide for yourself if that opinion's worth weighing. I've spent almost 40 years in healthcare company management, fundraising, and investment. So I have an opinion, and opinions are qualified by people's experience and whether those opinions can be backed up. Thank you very much. Mike, you got anything else to add here?
No, I want to thank the Global Health Impact Fund. I want to thank Dr. Bob Sweeney, our colleagues at BAMI, for all of you who have tuned in on the live stream. You can reach me at specinv.com or sicyber.com, and I'm easy to find.
Thank you very much, folks.
Thank you. Good night.